Assalamu alaikum. Greetings, my dear doctors, and welcome everyone to our radiology rapid revision session. And we'll be starting with our first session on approach to radiology. Before starting the session, let me give you some general instructions related to radiology and imaging for your MRCP Part 2 exam. So often I receive frequently asked questions. So how many radiology or imaging will be there in the exam? So roughly you can expect around 30 plus minus 2 related to radiology or imaging. And if you add the EKG, echocardiography, pacemaker along with the radiology, then roughly it should be around 35 plus minus 2. And if you further add the dermatology pictorials, fundoscopy, visual field pictures, then roughly it should be around 40 plus minus 2. So only isolated radiology or imaging, it should be somewhat around 28 to 33 within this range. And if you add everything, radiology, imaging, EKG, echocardiography, pacemaker, dermatology pictorials, fundoscopy, as well as the visual field, then it should be around 38 to 42, something in between this range out of the 200 questions. And with regards to the radiology and imaging, you should always try to correlate the 5 options, radiology, scenario, lab parameters to reach an unifying diagnosis. Don't be overconfident, ignoring solely relying on the radiology or ignoring the scenario. So you should maintain a balance. You should maintain a balance between the scenario, radiology, and try to reach the diagnosis. But in some cases, if you have absolutely no clue or no idea, or if the answer is very obvious, only in that case you can skip the radiology and try to find the answer using the scenario, or vice versa. So now let me start with the original discussion. So I'll be starting with the MRI first. So while encountering the radiology, we have to use some of the specific term. So we'll be starting with the MRI terminology. So whenever we'll be using the MRI terminology, we'll use the word intensity. So intensity is for the MRI terminology. So when describing the most MRI sequences, we refer to shade of gray of tissues or fluid with the word intensity. And with respect to the intensity, it can be used either as an absolute term or it can be used as a relative term. So when we'll be using the intensity as an absolute term, we will use as either high signal intensity or low signal intensity or intermediate signal intensity. So high signal intensity would be something that is white or bright. So either it will use the word white or bright, and it will be expressed in the absolute term as an high signal intensity. And low signal intensity means it should be either black or dark. And intermediate signal intensity would be similar to the gray type of color. So high signal intensity would be bright, low signal intensity would be dark. And when we'll be using the relative term, we often use as hyper intense, iso intense, and the hypo intense. So iso means the same brightness when we are comparing with an object or with a substance, and hypo intense means it should be darker or black, and hyper intense means it should be bright or it should be whitish in nature. So either we will use high signal intensity or hyper intense, or low signal intensity or hypo intense. And let me make another clarification for you. So you just need to remember whatever is written in this PDF. So anything else, whatever I might discuss, they are solely for the purpose of concept and understanding. So just try to remember, try to memorize whatever is there in the PDF. So can anyone tell me the neurological indications of cranial MRI? What are the neurological indications when we should go for the MRI? The gross indications. Yes, Dr. Naman.
Multiple sclerosis is one.
Yeah, we can go for multiple sclerosis. Other than multiple sclerosis,
We can do an
transverse myelitis.
yes, also in case of
like that.
transverse myelitis. So
And
we
what
can
is the
remember us
difference?
in for the detection of vascular pathologies like either ischemic stroke or hemorrhagic stroke, or AVM or aneurysm or venous thrombosis. So with respect to the vascular origin, ischemic and hemorrhagic stroke, AVM, aneurysm, venous thrombosis. And with respect to the venous thrombosis, it encompasses all types of the CVST, cerebral venous sinus thrombosis, whether this is superior sagittal or transverse. And other than vascular, also in case of tumor, and the tumor will be both primary CNS tumor as well as the metastatic tumor. Then we can also go in case of infection like cerebral abscess, or if there is any inflammation like cerebritis or encephalitis or meningitis. Then some of the inflammatory or demyelinating condition like multiple sclerosis or sarcoidosis. And you need to remember one thing very clearly: the CT scan does not detect the demyelination. So in any demyelinating condition, you should go for the MRI. So next one is the trauma. You can in case of epidural hematoma, subdural hematoma, or contusion. This type of epidural or extradural hematoma can also be seen in case of CT scan, but we can also go for the MRI. Then also the hydrocephalus, as well as the congenital malformation. So vascular, tumor, infection, inflammatory, demyelinating condition, trauma, and the hydrocephalus. So can anyone tell me the limitations of MRI? Some of the limitations.
So it takes a long time to do MRI, and the patient is supposed to lie still.
Yeah,
So if the
very good.
patient is not
So
clinically oriented, then it's difficult.
MRI requires the prolonged acquisition time for the production of images. So MRI is not suitable in the acute emergency condition, and this is one of the biggest limitations of MRI. And when we compare between MRI and CT scan, so remember two conditions: in case of acute hemorrhage and in the detection of bony injury, the CT scan is superior compared to MRI. So in case of acute hemorrhage and for the detection of bony injury, the CT scan would be superior to MRI. And both CT scan and MRI, both of them are subject to the motion artifact. So what may be the contraindication, relative contraindication to MRI?
Metallic walls are not compatible with MRI.
Yes, go on. Implant.
Metallic prosthetic, any metal prosthetics.
So if there is any implanted device or metallic device like the pacemaker or aneurysm clip, or if there is any cochlear implant, or if there is any artificial heart valves, also in case of intraocular metallic foreign bodies. And also in case of unstable patient, in case of emergency patient, you cannot go for the MRI. And pregnancy is a relative contraindication. You can go for the MRI in case of pregnancy, but unless this is absolutely needed, usually the MRI is avoided and CT scan is usually contraindicated. And also in case of severe hesitation, or if the patient has features of claustrophobia, then also in that case it is very difficult to go for the MRI. But patient with severe hesitation or with the features of claustrophobia, we can go for the anesthetic assistance, and afterwards we can go for the MRI. So we have already discussed one terminology, that is the intensity with respect to the MRI. So when we'll be interpreting the MRI report, we need to have we need to learn some other terminologies like what is meant by a lesion in the MRI. So a lesion in an MRI, this is an area of abnormal tissue that appears different from the surrounding tissue. So the abnormal tissue in case of MRI, this will be termed as a lesion. This abnormal tissue or abnormal lesion, it can be caused by cancer or infection or injury. And also we often use the term the edema. So edema in the normal sense, this is the swelling or inflammation caused by accumulation of fluid in the tissue spaces. And edema can be seen in an MRI as an area of increased signal intensity. So edema will look like increased signal intensity or hyper intense. And edema usually indicates the underlying injury or infection or other medical condition. Then there is another terminology known as the enhancement. So enhancement is an increase in the signal intensity in a specific area following the injection of a contrast material. So sometimes we need to go for the contrast MRI. So whenever contrast is used in case of MRI, it will show increased signal intensity or hyper intensity. This is known as the enhancement. Enhancement is used to identify the abnormal tissue, especially in case of tumor. The tumors will have an increased blood flow, and this increased blood flow usually causes more uptake of the contrast material. So for the detection of tumors, we can go for the contrast MRI. And also another most commonly used terminology is the sequence. So sequence is the single protocol used to acquire an image, and a long list of MRI sequences are used, but most commonly we go for the T1 weighted image and T2 weighted image. Other than T1 and T2, two others are also used. One is known as the Flair image, another one is the STIR pattern. But most commonly we go for the T1 weighted image and T2 weighted image. This T1 or T2 weighted images are used to highlight the different tissue characteristics and to aid for the diagnosis in various medical conditions. So what is meant by T1 weighted image? So T1 weighted is a type of MRI image that uses the T1 relaxation time of the tissue to create the image. T1 weighted image will highlight the soft tissue, and it can help identify the tumors and other lesions. So T1 weighted image, it will use the T1 relaxation time of the tissue, and it will highlight the soft tissue. And what is meant by the T2 weighted image? So T2 weighted is a type of MRI image that uses the T2 relaxation time of the tissue to create the image. And T2 weighted image will highlight the fluid filled spaces and can help to identify inflammation or swelling or fluid buildup. So in case of T1 weighted, it will use the T1 relaxation time of the tissues, and in case of T2 weighted, it will use the T2 relaxation time of the tissue. In case of T1, it will highlight the soft tissue, and in case of T2, it will highlight the fluid filled spaces. And we have already discussed the signal intensity. So signal intensity in normal terms, it refers to brightness or darkness of an area on an MRI image. So let's go for the MRI interpretation. So we need to differentiate between the T1 and T2 weighted image, and you need to remember 2 key points, and these 2 key points you should remember for your lifetime. So in T1 weighted image, the fat is white, and in T2 weighted image, both fat and water would be white. So this is all about fat and water, and by water we usually refers to the CSF in case of MRI. So the water or CSF, this is the differentiating point. The water or CSF, it would be dark in T1 and it should be bright in T2, and the fat components would be bright or hyper intense or white in both conditions. The 2 basic types of MRI images are T1 weighted and T2 weighted image, often referred to as T1 and T2 images. The timing of the radio frequency pulse sequences used to make T1 images results in images that will highlight the fat tissue within the body. The timing of the radio frequency pulse sequence used to make T2 images results in images which highlight fat and water within the body. So this makes things easy to remember. So in case of T1 image, one tissue type is bright, the fat components, and in T2, 2 tissue types are bright, both fat as well as the water, that is the CSF. So in case of T1, which component would be bright?
Fat.
Fat.
Yes, the fat component should be bright. And what should be the water or CSF in T1?
Dark.
Yes, it
Dark.
should be dark. And in case of T2, which components are bright?
Both
Water.
fat and CSF will be bright.
Yes, very good. So both fat and CSF would be bright. So the CSF would be black or dark or hypointense in case of T1, and the CSF would be white or bright or hyperintense in case of T2. So by looking at the CSF, we can easily differentiate whether this is T1 or T2. In a T1 weighted image, the image typically shows fat as bright or hyperintense and water or fluid-filled areas as dark or hypointense. Therefore, anatomical structures with a high fat content such as adipose tissue will appear brighter on T1 weighted image, while the fluid-filled structures like the ventricles of the brain and spinal canal containing the CSF will appear as dark. Other fluid-filled areas such as joint with synovial fluid, the bladder in the pelvis, the gallbladder, common bile duct, the ureter in the abdomen will also appear dark in T1 weighted image. In T2 weighted image, fluid appears bright or hyperintense. Therefore, areas filled with CSF such as brain's ventricles or the spinal canal are prominent. Other fluid-filled areas such as joint with synovial fluid, the bladder in the pelvis, the gallbladder, common bile duct, ureter in the abdomen will also appear bright in T2 weighted image. So they were appearing as dark in T1 and they will appear as bright in T2 weighted image. Also just memorize this gold standard point. So in general, T1 and T2 weighted sequence images can easily be differentiated by looking the CSF. The CSF is dark in T1 weighted imaging and bright on T2 weighted imaging. So CSF would be dark or black or hypointense in case of T1, and it should be bright or hyperintense or white in case of T2. So can anyone explain the T1 weighted, T2 weighted and Flair image with respect to TR and TE? What is meant by TR and what is meant by TE and their importance?
TR means time to repeat and TE means time for equal.
Yes, very good. So TR is the repetition time. Repetition time is the amount of time between the successive pulse sequence applied to the same slice, and TE is the time to echo. T is the time between the delivery of the radio frequency pulse and the receipt of the echo signal. So depending on the duration of TR and TE, usually the T1, T2 flare, this type of images are introduced or obtained. So in case of T1 weighted image, both TR and TE, both of them should be short. So T1, both TR and TE, both of them should be short. In case of T2, the TR and TE, both of them would be long. And in case of flare image, the TR and TE should be much more long compared to the T2. So it should be shortest. It should be shortest. The TR and TE, it should be short in case of T1. And the unit is usually the millisecond. So in case of T1 weighted image, the TR is usually 500 millisecond and TE is 14 millisecond. And in case of T2, the TR is around 4000 millisecond and TE is 90 millisecond. And in case of flare images, the TR is usually 9000 millisecond and TE is around 114 millisecond. And the flare image, flare means the fluid attenuated inversion recovery. The flare image is also similar to the T2 weighted image, but TE and TR, they should be much more longer compared to the T2. And there is another condition. Often you encounter the MRI with gadolinium contrast. So in case of gadolinium contrast, the T1 weighted imaging can also be performed uh, while doing the infusion of the gadolinium. The gadolinium is the non-toxic paramagnetic contrast enhancement agent. So when injecting the gadolinium during the scan, the gadolinium changes signal intensities by shortening the T1. So the gadolinium would be very bright on T1 weighted image, and gadolinium enhances the images that are especially useful in looking at the vascular structures and breakdown of the blood-brain barriers like the tumors, abscess, inflammation, especially the herpes simplex encephalitis as well as the multiple sclerosis. So in case of herpes simplex encephalitis and multiple sclerosis, we usually go with the MRI with gadolinium contrast, and in that case we use the T1 weighted imaging. There is another terminology known as the DWI, diffusion weighted imaging. So the DWI, this is designed to detect the random movements of water protons. The water molecules, they diffuse relatively freely in the extracellular space, and their movement is significantly restricted in the intracellular space. So they will move freely in the extracellular space, but the movement of water molecules, they are restricted within the intracellular space. And this diffusion is also known as the spontaneous movement. This diffusion or spontaneous movement, they become restricted in case of ischemic brain tissue. During the ischemia, the sodium potassium pump shuts down and the sodium accumulation occurs intracellularly. So water then shifts from the extracellular space into the extracellular from the extracellular space into the intracellular space due to the osmotic gradient. So as the water movement become restricted intracellularly, this results in an extremely bright signal on the DWI. So DWI is an extremely sensitive for detection of acute stroke, especially the acute ischemic stroke. So if you want to remember one thing with regards to DWI, remember this is extremely sensitive in the detection of acute ischemic stroke. Other than acute ischemic stroke or cerebral ischemia, it is also useful in the for detection of characterization in the tumors. But if you want to remember one thing, remember that DWI is extremely sensitive in case of acute ischemic stroke. So here is the link, most probably from the Radiopedia. So you can just go for the self-reading with respect to the MRI sequence by opening this link. So the T1 weighted image, it can be further subdivided into gadolinium enhanced, fat suppressed. So gadolinium enhanced, this is commonly done in case of T1 weighted image, and fat suppressed, this is done both in T1 as well as T2. And there are some others like proton density, DWI flow sensitive, as well as the AMR cholangiopancreatography. But just go through the T1 weighted, T2 weighted, and the Flair image. So next one is the chart. The T1 and T2 MRI images appearance of various structures in the brain, and you need to memorize this chart for proper diagnosis. So what should be the color of fat component in T1?
Bright.
Yes, it should be bright. And in case of T2?
T2 also will be bright.
Yeah, both the fat components would be bright both in T1 and T2. And if we compare between T1 and T2, usually this is more bright in case of T1. And what should be CSF in T1?
Dark.
Dark.
And in case of T2?
White.
Yeah, it should be bright. So the ventricles in case of T1, it will appear as dark, and the ventricle in case of T2, it will appear as bright or hyper intense. And the bones should be dark. Remember, the bones and the blood vessel, both bones and blood vessel, both of them would be dark, both in T1 and T2. So whether this is T1 or T2, the bones and the blood vessel, both of them would be dark. And in case of bone marrow, within the bone marrow, there is some of the fat content. So in T1, it will appear as bright. And in case of T2, this may be bright, but it would be less bright compared to T1. So is this T1 or T2?
T1.
So what should be the color of CSF in T1?
Black.
Yeah,
Black
so the
and hypo-
CSF would be black or hypointense. So within the sulcus, it is black, and also the ventricles. The ventricle containing the CSF, it will also be black. And the fat, the scalp region contains the fat, so it would be bright. And this one is the bone, and this bone will appear black. But within the bone, there may be some of the bone marrow components. These bone marrow components will appear bright in T1. And what should be the color of sinus in T1 and T2?
dark.
Yeah, in both cases, both in T1 as well as T2, the sinus would be dark or black. And the blood vessels, the blood vessel would be black both in T1 as well as T2. So what is the name of this structure? This one?
Ventricle.
Coordinate.
Yeah, this is the caudate nucleus. This is the caudate nucleus. And this one?
Globus.
Globus.
Yeah, this is the globus villus, and this portion is also known as the putamen. So putamen and caudate nucleus. So what should be the color of caudate nucleus in T1?
Ice so intense.
Yeah, it can be considered as an isodense. And in case of T2,
More hypodense.
yeah, it would be more hypodense. So this was our T1 MRI image of the brain. So the fat would be bright, hyperintense or white. Water or CSF would be dark or hypointense. And is it T1 or T2?
T2.
T2.
So what should be the color of CSF in T2?
White.
White.
Yeah, it should be white or bright, and this is the this is the main differentiating point. So in T1, the ventricles or CSF, they would be black or dark, and in T2, the ventricles or CSF, they would be bright or hyperintense. And the fat particles within the scalp, it will also be bright, but it would be more bright in the T1. And the blood vessels, the veins, arteries, the sinuses, all the three, they would be black or dark both in T1 as well as T2. So the caudate nucleus and putamen, they can much easily be differentiated in case of T1, but it becomes slightly difficult to differentiate them in the T2. So water CSF would be bright, hyperintense and white in case of T2. So next one is T1 and T2 MRI images appearance in various structures in the spine. So similarly in T1, the CSF would be dark, the bones would be dark, the fat would be bright, and the intervertebral disc, they would be intermediate. And in case of T2, the CSF would be bright. So previously the CSF was dark. In case of T2, the CSF would be bright, and the fat is bright in both T1 as well as T2, and both bones would be dark. So you can see here the fat particles. The fat particles is appearing as a bright. This is the spinal cord. The spinal cord is usually iso-intense, and in front of the spinal cord we can see the CSF. So CSF would be dark or black in case of T1, and it should be bright. You can see here the CSF is bright. The CSF is bright in T2, but in case of T1 it should be black. And the bone marrow would be intermediate since it contains very low amount of fat. And the muscles will also be intermediate, as well as the intervertebral disc. So intervertebral disc, this is usually iso-intense. The intervertebral disc is usually iso-intense, and the bone marrow and the muscles, they are usually the intermediate. So is this T1 or T2?
T1.
T2.
T1. CSF is black.
Where is the CSF?
Oh, sorry, T2. That's the spinal cord, not CSF. In between.
Yeah. So this one is the spinal cord. Okay. So don't get confused. So these are the CSF. These are the CSF. So this is bright. So this is the T2 component. So this one is the spinal cord. This is not the CSF. So in case of cervical spine, look at this carefully. This is the spinal cord. So next one is T1 MRI images of the lumbar spine. So similarly, the spinal cord, it will appear as black. The CSF would be dark. The fat would be bright. Muscles would be intermediate. The ligaments would be dark. So memorize this. The ligament would be dark in T1. And the intervertebral disc, this is usually iso-intense. And in case of T2, the CSF would be bright. The ligament is also dark. So ligament is dark both in T1 as well as in T2. So whenever there is any abnormalities, any tearing or inflammation in the ligament, it will appear as hyperintense, whether in T1 or T2. So next one is T1 and T2 MRI images appearance of various structures in the heads and neck. So CSF is dark in T1 and the fat would be bright. The bone marrow contains fat, so it will also be bright. The bones and blood vessel, whether this is T1 or T2, they would be dark. So bones, the blood vessels, they would be dark. The CSF and fat components would be bright in case of T2. So this one is T1 MRI image appearance of the neck. So the teeth will also appear as dark and the fat would be bright. The CSF would be dark. And this one is the T2 MRI image appearance of the neck, and also the CSF would be bright. So next one is T1 and T2 MRI images appearance of various structures in the pelvis. So what should be the color of ureter? The color of ureter in T1, and what should be the color of ureter in T2, or urinary bladder?
T1, will be hypotense, and in T2, it will be hyperintense.
Yes, excellent. And in case of synovial fluid within the hip joint?
Same, hypointense in T1 and hyperintense in T2.
Yes, very good. So we'll always remember with regards to the water or fluid type of components, they would be dark in T1, whether this is CSF or this is urine or this is synovial fluid. All types of fluid components, they would be hypointense in case of T1, and they would be bright or hyperintense in case of T2. So in case of T1, the fat would be bright. The ureter, it would be dark, containing the urine. The synovial fluid would be dark. The urinary bladder filled with urine, it will also be dark. And in case of T2, the urinary bladder containing fluid would be bright. The ureter containing urine would be bright, and synovial fluid will also be bright. So is this T1 or T2?
T1.
T1.
So the urinary bladder is dark. So this is T1. And in case of T2, so look at here, this is not contrast. In T2, the urinary bladder will look as an hyperintense. So looking at the bladder in case of pelvic MRI, so if the bladder is black or dark, this is T1. And if the bladder is hyperintense or white, this is T2. So T1 and T2 MRI pathology appearance. In MRI, the signal intensity of tissue or pathological processes on T1 weighted and T2 weighted image is determined by relaxation properties of hydrogen proton within them. In T1 weighted images, areas with shorter T1 relaxation times appear bright, whereas in T2 weighted images, areas with longer T2 relaxation times appear bright. Pathological process such as edema, inflammation, or tumors often involves an increased water content. The presence of increased free water lengthens the T2 relaxation time, causing these areas to appear bright in T2 weighted image. Conversely, the same regions often appear dark in T1 weighted image because the free water has a longer T1 relaxation time. This contrast difference is pivotal in MRI's ability to discern pathology, as this signals changes against the backdrop of normal anatomy highlight areas of concern. Here are some of the examples of the pathologies. So also you need to memorize this page. So what should be the color of edema or inflammation in T1 or T2? What should be color of edema or inflammation in T1 and T2?
Hypointense.
Bright.
So edema will contain the fluid. So
Fluid.
edema
White.
or inflammation, they will appear low signal in case of T1 and they will have high signal in case of T2. And in case of acute hemorrhage, so usually in case of hemorrhage may be acute, subacute, chronic. So depending on the duration, usually the appearance will changes. And the cyst also usually contains the fluid, so it will be low signal in case of T1, and cyst would be high signal in case of T2. And also the tumor will also be variable depending on the vascularity or necrosis. The abscess would be low signal in case of T1, and the abscess would be high signal in case of T2. And what should be the fatty lesion in T1 or T2? I mean in case of lipoma.
Right on both.
Yes, very good. So
Hyperintense.
in case of lipoma or in case of fatty lesion, there would be high signal intensity both in T1 as well as in T2. So avascular necrosis, AVN, what should be AVN in T1 and T2?
I think it should be
Yes,
black.
necrosis like inflammation.
So in case of T1, this is fixed. In case of avascular necrosis, especially avascular necrosis of femur, in case of T1, there will be low signal intensity. But in case of T2, this is variable depending on the duration. And with respect to the multiple sclerosis, multiple white matter plaques, in case of T1, it should be low signal. And in case of T2, it should be high signal. Which type of sequence is most commonly used in case of multiple sclerosis? T1
Flair.
or T2
Flair.
or Flair or STIR pattern?
Flair.
Flair.
In case of multiple sclerosis, we commonly go for the Flair sequence. And in case of decompensated thyroid eye disease, which sequence is most commonly used?
STIR.
Yes, the STIR pattern is most commonly used. So what is this structure?
Kidney.
Yeah, this is the kidney, and the renal cyst is looking as dark. So is this T1 or T2?
T1.
Yeah, this is T1. And look at here, in case of T2, it will appear as hyper intense. So next one is the Flair sequence. So Flair is the fluid attenuated inversion recovery. So in case of Flair sequence, we'll remove signal from the CSF. So the CSF will appear as dark. So in case of Flair image, the aim or principle is to nullify or cancel the signal from the fluid. So in case of T1 image, in case of T1 sequence, the CSF is normally dark. So T1 Flair will also be dark, but the normal T2 sequence, the CSF would be bright. But if we go for T2 Flair, so the Flair will nullify or cancel the signal from the fluid. So T2 Flair image, the CSF will appear as dark. A brain tissue on Flair image appears similar to T2 weighted image. Gray matter brighter than the white matter, but the CSF is dark instead of the bright. So the CSF would be dark in case of T1 and in case of Flair image, and the CSF would be bright in case of T2. And the physics behind the Flair images, to null or to cancel the signal from the fluid, the inversion time Ti of the Flair pulse sequence is adjusted such that at equilibrium there is no net transverse magnetization of the fluid. So just remember this line: in case of Flair, the signal is removed from the fluid, so fluid will appear as dark in the Flair sequence. Flair fluid attenuated inversion recovery MRI is an imaging technique used to suppress the signal from the fluids in the body and improve the contrast between the fluids and surrounding tissues. Flair MRI is a special type of MRI sequence used predominantly in neurological imaging to enhance the visibility of lesions and abnormalities in the brain and the spinal cord, especially in case of multiple sclerosis. So with respect to multiple sclerosis, always remember we go for the Flair sequence. It suppresses the signal from the CSF, making abnormalities in the adjacent white matter. So in case of multiple sclerosis, there will be disseminated or widespread degenerative white matter plaques. So this white matter plaques may get confused along with the color of the CSF. So we will suppress the signal from the CSF, and only the white plaques, they will appear as bright in case of multiple sclerosis. So this is the physics behind going for the Flair in case of multiple sclerosis. So let's look for the T1 Flair appearance. So in case of T1, normally the CSF is dark. So but in case of T2, sequence, the CSF would be bright. But when we go for the T2 Flair, the signal is cancelled from the fluid. So the CSF will appear as dark in case of T2 Flair. So both in T1 and both in Flair, the CSF would be dark. And the CSF would be bright in which condition?
T2.
Yes, it should be bright in case of T2. And the with respect to the fat should be bright in which sequence, and it should be dark in which sequence?
Both in T1 and T2.
So in
But
T1,
Right.
T2, as well as in case of Flair, in all the three conditions, the fat would be bright. T1, T2 and Flair, in all the three conditions, the fat would be bright. The only exception is the star pattern. So let's go for the star pattern. So star means the short tau inversion recovery. In case of star, we remove the signal from the fat. So the fat will appear as dark and the CSF will appear as bright. So in case of Flair, we cancel the signal from the fluid. So the fluid or CSF, they will appear as dark in case of Flair, and in case of star pattern, we remove the signal from the fat. So the fat will appear as dark. So the star sequence is completely opposite to which sequence?
Flair.
Flair. T2.
Try again. Not T2, not flare. In case of flare, the fat would be bright. So I was saying
T1.
yes,
T1.
very good. So in case of T1, the fat would be bright and the CSF or fluid would be dark. But in case of star, the fat is dark, the CSF or fluid is bright. So T1 and the star pattern, both of them are completely opposite. So the star images are highly water sensitive. So water or CSF will appear as bright. And this water or CSF would be dark in case of T1. So next one is the flare appearance of the brain as well as the star image. So in case of flare, we are cancelling signal from the fluid. So CSF will appear as dark and the fat would be bright. And in case of star pattern, we are cancelling the signal from the fat. So fat will appear as dark and the CSF will appear as bright. So is it clear for everyone? The T1, T2, the overall overview, the colors. Is it clear for everyone?
Yes, sir.
Yeah,
Okay.
to an extent it's clear.
Okay. So which type of sequence is this?
Flair.
Why not this is T1?
T1.
Because fat is not bright here. Fat is also dark.
Yes, very good. And this one?
This is stir.
Yes,
Because
this is the star
fluid is
pattern.
black, fat is white.
Yes, very good. So the fluid is appearing, the CSF is appearing as bright. This and the fat is appearing as dark, which is completely opposite to the T1. In case of T1, the CSF would be dark, the fat would be bright. So this is completely reversal of the T1. So this is the star pattern. So next, most probably this is another link from the Radiopedia with respect to the terminologies. So you already know the basic terms, the planes. Okay, so we have the coronal plane. We have the coronal plane. Coronal plane is also known as the frontal plane. So if we cut across the ear, or in Bangla this is also known as if we cut along the মানে কান বরাবর কাটলে যেটা সেটাই হচ্ছে coronal plane. So in case of coronal plane, if we cut across the ears, so dividing the patient into anterior and posteriorly, if we divide a patient into anterior and posterior segment, cutting through the ears, this is known as the coronal plane or frontal plane. Or also you can remember during the coronavirus attack or during the COVID, so we used to wear mask in the anterior portion of our face. So the COVID or coronal or frontal plane, it will differentiate into anterior and the posterior segment. So the coronal plane is a vertical plane perpendicular to the median plane, and it divides the body into anterior and the posterior part. So this coronal plane, this is also known as the frontal plane. Then we have the horizontal plane, also known as the axial plane or transverse plane, also known as the transaxial plane. So if we cut across the 90 degree, this is known as the horizontal plane. The axial plane, horizontal plane perpendicular to the long axis of the body, it divides the body into superior and the inferior parts. Then we have the sagittal section, also known as the longitudinal plane. So if we cut across the midline, so through the nose, so this is known as the sagittal section or the longitudinal section. Or alternatively, you can remember, so when we cut through the midway of the sex organ, this is the sagittal plane. So sagittal means the midway through the nose or midway through the sex organ. And if we go a little laterally, this is known as the parasagittal plane. So I think all the planes are clear to everyone. So coronal plane, if we are cutting through the ears, dividing anterior posterior, this is the coronal plane. The sagittal plane across the nose or midline through the body or through the sex organ. And this is the axial plane or horizontal plane. So next we'll be starting with the CT scan. Also, can anyone tell me the basic principles of CT scan?
CT scan is somewhat like a 3D X-ray.
Yes, very good. So the CT scan, they are created using a series of X-rays, which are a form of radiation in the electromagnetic spectrum. And this electromagnetic spectrum or transmission, this is known as the attenuation. And the amount of attenuation is determined by the density of the imaging tissues, and they are usually designated by the hounsfield unit. And this hounsfield unit, it can be either high density tissues, such as in case of bones, the bones will absorb the radiation to a greater degree, and the reduced amount is detected by a scanner. And in case of low density tissues, such as in case of lungs or in case of pneumothorax, it will absorb the radiation to a lesser degree, and there would be greater signal detected by the scanner. And the main differences between the conventional X-ray and CT scan is that the conventional X-ray are the two-dimensional images, and the CT scan are the three-dimensional plane. This is the main differences. And to obtain the three-dimensional plane, we need to go for the multiple projections from different angles, and these projections are known as the reconstruction. So the 3D X-ray acquired by specific projection known as reconstruction is nothing but the CT scan. And also in case of CT scan, we can go for the contrast imaging. So depending on the structures, the CT scan can be used either with contrast or without contrast. And often we use this term. The investigation of choice is CT scan with contrast or CT scan without contrast. And the introduction of an IV radiofluorescent contrast into the bloodstream can be used for a variety of diagnostic purposes. For example, in case of cardiovascular system, for investigation, in case of suspected aneurysm or aortic dissection or atherosclerotic disease, and also in case for the identification or detection of tumor, whether this is malignant or this is benign. And usually following the IV injection of iodinated CT contrast, usually it takes around 5 to 7 minutes for the contrast to expel from the body through the urinary system. And this contrast can also be seen in the ureter if you go for the CT urogram. And in some cases you need to go for the oral contrast. Oral contrast is usually used in case of also known as the barium swallow X-ray, in case of like Crohn's disease or bowel obstruction or diverticulitis, or in case of appendicitis. So in case of X-ray, in case of CT scan, the X-rays are applied in a circular motion with detectors on the opposite side of the body. The body tissue slices are usually 1 centimeter, which are mathematically reconstructed and displayed on a grayscale. The density of the tissue is in proportion to attenuation of X-ray. So the density of the tissue or density of the organ, this is directly proportional to the attenuation of the X-ray. the tissues like air or water, they have very little attenuation, and so they will be displayed as low densities, meaning they will appear as dark. But in case of bone, they usually have a higher attenuation, so they will display as an higher density or bright in case of CT scan. And among the other pathological condition, in case of hemorrhage, especially in case of acute hemorrhage, in case of hyperemia, in case of contrast, it will appear as high density. So remember three condition. Remember three condition in case of CT scan: acute hemorrhage, hyperemia, use of contrast. These three will have high density or hyperdense, known as white. And in case of edema and necrosis, remember edema and necrosis, both of them will have the low density or hypodense or black. So you must remember this 5 condition in case of CT scan: acute hemorrhage, hyperemia, contrast. All the three will appear as hyperdense. And whenever there is perilesional edema, whenever there is necrosis, there would be hypodense or black. So edema and necrosis would be dark in case of CT scan. And if you go for the also in case of MRI, usually we go with the gadolinium contrast. And in case of CT scan with contrast, usually we go with the iodinated contrast. And this iodinated contrast with CT scan, this is usually more suitable for the detections of 3 conditions: tumor, infection, and inflammation. So can anyone tell me the neurological indication of cranial CT?
To rule out an acute hemorrhage, subdural hematoma, epidural hematoma, subarachnoid hemorrhage.
Also remember one gold standard indication of CT scan in case of acute emergency condition. In case of acute emergency condition, usually the CT scan is indicated. So CT scan is most commonly indicated in the emergency room evaluation with acute head trauma or acute neurological dysfunction. So in case of acute head trauma, we usually look for the intracranial or subarachnoid hemorrhage. Also in case of acute neurological dysfunction. So acute emergency condition presenting with either acute head trauma or acute neurological dysfunction, go for the CT scan. And one of the greatest advantages of CT scan when we compare it with the MRI is that it has an extremely rapid acquisition time, and the sensitivity of detecting hemorrhage is the modalities of choice. So for the detection of acute hemorrhage, CT scan is more sensitive compared to the MRI. So in general, in case of vascular pathologies, the acute hemorrhage, in case of acute hemorrhage, acute intracranial hemorrhage, or acute hemorrhagic stroke, the CT scan is the gold standard. And in case of ischemic stroke, always remember, if you go for the CT does not detect the acute ischemic stroke, especially if this is less than 36 hours. So it should be at least 36 hours in case of ischemic stroke to have evidence in the CT scan. So acute ischemic stroke less than 2 days, go for the MRI. But when the duration is greater than 2 days, you can also go for the CT scan. But in case of acute hemorrhagic stroke, the CT scan is gold standard, and this is more sensitive compared to the MRI. And also in case of trauma, you can go for a CT if this is acute emergency condition. And in case of hydrocephalus, both we can go for the MRI as well as the CT scan. And the CT scan with contrast, this is usually indicated in case of tumor as well as infection and the abscess. So what are the limitations of CT scan?
It is not
Severe renal impairment.
soft tissue. It's not see very nicely on CT scan. Only for hard structures, it's good.
Yes, very good. So CT scan, this usually the hard structures, especially the bony structures. Bony structures are easily visible in case of CT scan, but if we need the tissue structures, then we need to go for the MRI. And CT scan is only limited to the axial view. You cannot go for other view like the coronal view or some other view. The CT scan can only be obtained in case of axial view. And the CT scan cannot detect the acute ischemic stroke when the duration is less than 2 days. The CT scan does not detect the demyelination. For any demyelinating condition, you should always go for the MRI. And the CT scan also does not detect the Leconer stroke, especially when it occurs within the brainstem. And also in case of herpes simplex encephalitis, you should always go for the MRI. And also in the exam, whenever they give you imaging with respect to herpes simplex encephalitis, they will give you the MRI image, and you will get the increased signal intensity in the temporal lobe, either unilateral. In most of the cases, this is unilateral. And also remember another important note. So in case of CT scan images, the slices are taken at an angle, but in case of MRI, you can have the true axial slices. So in case of CT scan, the structures near the top of the slice, they are more rostral than the structure near the bottom of the slice. So what are the contraindication of CT? Most common relative contraindication?
Pregnancy.
Yes, very good. So pregnancy is one of the relative contraindication, and also if there is any prior history of anaphylaxis to the IV contrast agent, or if there is any renal dysfunction, then you cannot go for the CT contrast. So we should go for the CT scan terminology. So previously, with respect to MRI, we used the intensity. So intensity in case of MRI, but in case of CT scan, we'll use the word density. Density may be isodense, hypodense, hyperdense. So hypo means black or dark. So what type of lesion is this?
Hypodense.
Hypodense.
Yes, this is the
Hypodense.
hypodense. So hypodense, this is the, it will appear as black or dark. So normally the ventricles containing the CSF, they would be dark. So the ventricles or CSF, they are dark both in CT scan as well as in case of T1 MRI. So the isodense, so isodense means they will usually have the same color with respect to the brain matter. So this is the isodense. And the hyperdense would be white or bright. So most common cause of hyperdense lesion in the CT scan?
Hemorrhagic stroke.
Yes, acute hemorrhage. Any
Hemorrhage.
acute hemorrhage leads to hyperdense lesion in the CT scan. So acute hemorrhage will have hyperdense lesion. The chronic hemorrhage will have hypodense lesion. The subacute hemorrhage will have isodense lesion. If there is acute on chronic bleeding, there should be both hypodense plus hyperdense lesion. Remember this. So next one is our CT attenuation based on the density, and we use the hounsfield unit, in short HU, and you should memorize this. So what is the range of hounsfield unit? Ranges. What is the lowest range, or what is the extreme range in the negative and in the positive?
Minus 1,000.
Yes, minus 1,000 to plus 1,000.
1,000.
So minus means the more will be hypodense, the more will it be minus. And the plus means the more will it be hyperdense, the more will be the within the positive side. So how is the density measured in the CT scan? Radio density on CT is measured in hounsfield unit. The hounsfield unit ranges from minus 1,000 to plus 1,000. So by definition, the water or CSF. So remember, the water or CSF, they are at the central point, so they will appear as 0. So this is usually looks like something like the isodense. The water, the CSF, they will usually appear as isodense in the CT scan. The air is the -1000 because this is the least dense structures. So the air or pneumothorax in case of lung pathology, they will be hypodense and they have the highest degree of hypodense. And in case of bony structures, it should have highest degree of hyperdense, and this is +1000. The fat is less dense than water and therefore measures than -100. So water is in the central point, the fat will appear as hypodense. And if we compare between brain and blood, so brain, the blood would be more hyperdense compared to brain. And if we compare, so we are discussing the hounsfield unit. So the fat is less dense than water and therefore measures -100. So the fat would be hypodense. Usually the fat is hyperintense in T1, T2. But in case of CT scan, the fat would be hypodense. And if we compare between brain, blood, and calcification, so the if we compare among the three, so calcification will have the highest density. The mid would be blood, especially the acute hemorrhage, and least would be the brain. So usually at around this range, the calcification will occur. And if you compare between calcification and bone, the bone is the highest dense. So the calcification will appear slightly lower dense when we compare with the bone, but it will have greater density than the acute hemorrhage. A brain parenchyma is more dense than water and ranges from +20 to +40. White matter is less dense than gray matter due to the fat within the myelin within the white matter. Acute blood is bright on CT, measures as +55 to 75. Calcification is more dense than blood and will measure in the low 100. So water and CSF, they will have within the central point or 0. The bone would be highest dense, the air would be lowest dense, or air would be most black, bones would be most white. And in case of hemorrhage, in case of acute hemorrhage, highest degree of density, hyperdense. In case of subacute hemorrhage, usually isodense, and in case of chronic hemorrhage, usually hypodense. And in case of acute on chronic bleeding, there should be combination of both hyperdense as well as hypodense lesion. So you must memorize this hounsfield unit. It will help you to diagnose the pathology more easily. So next one is the enhancement. So the term enhancement refers to structures or lesions becoming brighter on imaging after an intravenous contrast medium has been injected, and can be used when the contrast has been injected for the CT, MRI, or an ultrasound. So whenever we are going with the contrast, either contrast MRI or contrast CT or contrast ultrasound, we will be either using the IV contrast materials or we will be using the gadolinium contrast, and this increased contents or increased brightness, it will be used by the terminology as the enhancement. So here are a long list of modalities, and in the left side will appear as bright image. That means all of them will appear as white, the left components, and the darken image, so all the right components, they will appear as black. So the bright is also known as opacity or density or hyper intensity, and dark means the lucency. So the radio opaque means it should be bright or whitish, and radiolucent means it should be black or it should be dark. So in case of CT scan, we use the density. So hyperdense or white or bright, also known as high attenuation, and hypodense or dark or black, also known as the low attenuation. In case of MRI, we use the intensity. So either hyper intense when this is used as a relative term, or high signal intensity when this is used as an absolute term, and hypo intense or low signal intensity. In case of ultrasound, hyper echoic or echogenic or increased echogenicity. So whenever you found hyper echoic or echogenic or increased echogenicity, it means it will appear as white or bright. And whenever you find hypoechoic or anechoic, it will appear as dark. And in case of nuclear medicine, we usually use the term either increased uptake or decreased uptake, or this is termed as an FDC avid when describing a PET scan. In case of PET scan, we will use the FDC avid. So in a medical context, the term avid is often used to describe how a part of the body absorbs a substance or react to a treatment. So usually multiple areas of FDC uptake makes the metastasis more likely, and whenever there is an isolated FDC avid lesion, it can be either benign or malignant. But whenever, so if you find a single FDC avid, it may be either benign or malignant etiologies. But whenever there is multiple areas within the FDC uptake, most likely this is the metastasis. And also with regards to the T1 and T2, let me give you another mnemonic. So let's consider this is T1. So T1 is a single person, he doesn't have any partner. So the person would be usually depressed, and he does not need, or he don't use the Fair and Lovely to impress his partner. So that person is usually dark. So in case of T1, single person, the person would be dark. And in case of T2, they are two person or they are partners, so usually they are happy, they are usually bright, and they usually use the Fair and Lovely to impress others. So in case of T2, the water or CSF, it will appear as bright. So T1, depressed person, single person, no partner, dark. T2, two partners, happy person, and they are the fair or they are bright. So any further question from today's session? Any questions or any queries from anyone? Okay, I think then we can conclude here. Okay, thank you everyone.
Thank you.
Thank you.